So I'm the person from Barcelona. Unfortunately, I've got a bit of a cold, what makes it a bit more difficult to hear something and also to talk a little bit. But my talk will go a bit more about how to make cities a bit healthier, in particular introducing more green space and introducing more active transportation. I'm going to make a case for that. For this also I'm going to show some studies on quantitative health impact assessment. I assume that all of you are familiar with this. If you're not, I can give you a quick lesson after the talk about this. So how do we make, so where are we at the moment with cities? I mean, I think, you know, at the moment, more than 50% of people actually live in cities, goes up to 70% worldwide. And we haven't been doing so well, I think, often. I mean, what we see in our city development are kind of two models. One is very dense, compact, going up. Shenzhen, China, developed very quickly. Or another kind of model is where we look at very sprawled cities. Los Angeles is an example. Atlanta, which I have here, very long distances. People need to travel from one side to the city. I think in between these two, many of the cities you can divide into this kind of two areas. Where actually probably the ideal city is more in the middle of some of this, a bit more compact, with some housing that is not too high in a way that. One of the big problems here is also that because of the way we've designed cities and what they are at the moment, is that we're very reliant on the car. Many cities are car dominant. I mean, here, particularly in the US when I come here, but even, you know, when I go to cities like what you see in where I come from, Barcelona, we have many cars. I mean, even though cars are not the predominant mode of transport, a lot of the public space is actually taken up by cars. One of the big problems for cars, with cars, is actually that, you know, 96% of the time they're parked. They're just sitting there. I mean, you know, you can see here, Paris, wonderful city. But, you know, imagine now that there wouldn't be any cars, but you had, for example, some trees here that would be a much nicer environment to be in. And we know that green trees are healthy for you. So over the last 10, 15, 20 years, perhaps more, we've now come to realize that there's a strong relationship between how you design cities, how people get around the cities, what kind of environmental exposures this lead to, or what kind of lifestyle changes, and also how this then may lead to morbidity and mortality. So, for example, I mean, if you design a city for cars, you put in a lot of infrastructure for cars, you're going to get a lot of people that use a car. This leads to air pollution, leads to noise, what you also can see in warmer climates, heat island effects. You know, the center is 4 or 5 degrees hotter than the surrounding areas. Leads to stress. We know that car users are more stressful, less social context, and in particular also less physical activity. On the other side, if you design a city for active transportation, say if you put in cycling lanes, you get many more people to cycle. I'll come back to that later. What you get then is less air pollution, less noise, you need less space, less heat island effects, less stress, less social context, more physical activity, reducing mobility and reducing premature mortality. We recently did a burden of disease assessment in Barcelona, and we looked at how many deaths are attributable to high air pollution levels, high noise levels, lack of physical activity, lack of green space, heat island effects in Barcelona. And we found that almost 3,000 premature deaths, or about 20% of the total number of deaths, could be attributable to these particular factors. So it's very important for public health in this way. It's an important determinant. And Barcelona is not so different from many other cities. I mean, we have a fairly high traffic density, probably higher than you have here in Philadelphia. But, you know, we looked at other cities and we see similar numbers as this as well. So we can't ignore it anymore. We can't put our head in the sand, and we need to do something. So, but it's not so easy to change your cities, or how to get people more active, get active transportation or so. But there are some things what we're starting to do. And first of all, I would like you to show an example how you perhaps can change the space, the public space that people use, and give it a different purpose. As what I said, this is Barcelona. We have a grid system here. The city was designed to be, 200 years ago, or this part of the city, to be healthy. Ildefonso Sada designed this really nice grid system where big roads would be here and to have a lot of fresh air. In the middle of the apartment blocks, there would be green space, there would be parks. I mean, if you read his plans, I mean, it was wonderful for public health. What happened was, when the car was introduced in the 60s, the nice big white roads got filled up with cars. The middle here got used by developers to put garages and whatever other stuff, so no green space. So that's why we have these problems. But now we're rethinking how we use this space, how we may change it. And the idea is in Barcelona to cut off here the junctions for through traffic and create what we call superblocks. So this is the principle of superblocks. What you see here is the current situation. I mean, here in the US you have also the grid system. What we have at the moment, we have a lot of cars. Also we have a lot of motorbikes in Barcelona. And so the idea with the Barcelona superblocks is that to cut off the junctions and here create this space more for pedestrians, cyclists, other activities for people to enjoy the space, to reclaim the space from cars. So the cars now just go around the space. That's what you can see here. So what we did, well, I've got another photo actually what it looks like. A few of the super blocks have been introduced. This is one here, which you can see. This is the Sant Antonio one, where you see before there were cars, and now this is what it looks like afterwards when they actually changed. The idea is to create 500 super blocks in Barcelona altogether. We're at the moment at number 3 and 4, so we still got a long way to go, but it's a start. So what we did as part of a study is to model what would be the impact on cars, air pollution, etc., if we would implement these superblocks, and what would be the health impacts. Now, this study is going to be published on Monday. Please don't take any pictures of this, or don't think about it. Ignore it until Monday. It's under embargo. But what we see is that we expect that there's a 20% reduction of car use, a 24% reduction of NO2, nitrogen dioxide, noise reduction, also increase in green space, because the idea is for the superblocks to make more green. And also we get a reduction in surface temperature because there's more green and you don't have cars, what you get. So what are the health impacts of this, if this would happen? What we can see is that we would prevent 667 deaths per year, each year, if we would implement these measures. The superblocks. In particular, what we see, the biggest contribution comes from air pollution. We have large air pollution, or considerable reduction in air pollution, almost 300 deaths prevented. And then also we see for noise, heat islands, green space introduction. And physical activity benefits are not big at the moment because we don't have real good estimates for how much physical activity may increase. So we just use a very, very conservative estimate of changes. So. But you can see that, reusing the space has real public health benefits. James Woodcock did a similar exercise in the UK under the Vision 2030 project, where they were imagining what future cities, what future streets would look like. In the UK, I mean, what you could do with them. I mean, the typical street in the UK, again, I mean, it's like what you see here, houses with lots of cars parked outside. And so they imagined, different visions in the future where you have fewer cars outside, more green space, here only public transportation and green space, and here green space and and mostly active transportation. And so also they modeled this, what would be the health impact? And actually what they found, but for these different visions, there would be large health impact if we could get people to shift from, using the car to active transportation and from a grey street to a green street. And in this way, they estimated that between 4,000 and 8,000, 9,000 DALIs per million could be avoided if they would introduce vision 3, for example, or when you go to these different visions. And most of the benefits here, they actually come from physical activity. As you all know, physical activity is a big problem. Most people don't do enough physical activity, and we need to encourage people more to do physical activity. So one way to do is what I said, getting people out of the car and starting to cycle. I mean, and it's possible. Most of 50% of the journeys or trips that people are making by car are less than 5 kilometers. I mean, you could easily walk them, you could easily cycle. Unfortunately, often the infrastructure is not there to be able to do that, and that's quite important. We know that cycling has many health benefits, reduce premature mortality, but it also, it allows you to combine your commute to work with being in the gym. I mean, most of you don't have enough time, or most people don't have enough time to go to the gym. If you cycle to work, you have your gym stuff done. Less air pollution, less noise, also less CO2 emissions what you have. People are happier, and also the cyclists use much less public space. We know now that the physical activity benefits well outweigh any risk of air pollution or accidents. I mean, shown many times over that. Some of the interesting developments we have seen here, the public bike sharing systems. They work quite well in some cities. I mean, like in Barcelona, a lot of people started cycling. I know in other places they don't work as well, but that's good. And, for people that say it's too hilly in my city, I can't cycle, or the distance is too long. Nowadays you have the electric bike. I mean, you don't have an excuse anymore. They're wonderful things. I mean, and they're very much used, so that's easy to do. Last week, we were at the ISE conference in Utrecht, a nice little town in the Netherlands. They've been supporting cycling policies for now quite a few years. And this is what you see. I mean, in the city center, where you see all the people cycling here, that it's super busy. This is the road. You don't see, or very few cars. You see a bus there. But this is actually what you can achieve with a sustained policy moving to active transportation, or to cycling in particular. The key, though, is that you need to have good cycling infrastructure, and that's often forgotten. So we asked ourselves, if there are more cycling lanes, do people cycle more, and how many deaths could that prevent? So in this study, we looked at 168 cities in Europe. We looked at the relationship between the availability of cycling lanes per 100,000 people and the percentage mode share of cycling. And what you see here is that there is an almost linear relationship between how much cycling infrastructure there is and the percentage mode share, up to about 25% mode share, and that's pretty high. Above that, it actually breaks down. But what this suggests is that you need to have very good cycling infrastructure. This is only segregated cycling lanes that we counted, to get people cycling. Then this is done, as what I said, 168 cities, covered 75 million people. And we predicted that, or tried to estimate that what would happen, how many deaths could we prevent if we would get up to 25% mode share for all these cities. And we suggested, or we found that you could prevent over 10,000 premature deaths each year if the cities would go up to 25% mode share. Now, in the last couple of minutes, I would like to talk about another one. What I said is quite important, and that's greening of cities. Often you think about parks, of course, as places, but I think what is also important, or what suggests, is that you have street trees. I mean, they may have as many benefits where people get in contact with, in particular because, green may actually reduce stress and prevent mental health, what I think is one of the main pathways. If you're more interested in this, we recently did a review on this to to see what's out there at the moment for the literature. There are quite a few good reviews on there, but it took this. So what you see so far is that greening cities actually may lead to quite a few benefits. What is well documented: longer life expectancy, fewer mental health problems, better cognitive functioning at both sides of the lifespan. For kids, I mean, their cognitive functioning is better when they live in greener areas. For the elderly, their cognitive decline is slower. But also you see healthier, bigger babies. That's what's happening. Furthermore, we know it mitigates air pollution, heat and noise islands, and replacing roads and parking with green environments is one way of changing a detrimental environment to a beneficial environment. And so one really nice study that was recently done by Michelle Kondo, who's here somewhere as well. I don't know where Michelle is, but if you want to, at the back, if you want to talk to her, she recently did a health impact assessment of here in Philadelphia. So the policy here in Philadelphia is trying to get 30% tree canopy cover in all the places, in all the different neighborhoods in Philadelphia. And many of them are not yet there. Some of them already have 30%, many of them not. So she looked at, what if we would get up to 30% tree cover and develop this tool to estimate this. And she estimated that you could prevent over 600 premature deaths per year if we would get up to 30% tree cover, and this would result in over $6 billion of averted cost. Now you always wonder, is this possible? And it's been done in different places. We see replacements of road with green space. This is the kind of what you see in Seoul, where they just removed a major roadway and put in things. But what we need is work with other communities. Most of you are from public health. Actually, we can't make a difference. The people that can make a difference are urban and transport planners. And that's what you need to go out with and talk to and say, how you design your cities, how do you design the transport systems, has a large effect on public health. And you need to do it in a much better way. Now, I can talk for hours, but I don't have any time anymore. But if you want to read more about this, we recently published a book, 700 pages, full of everything what you want to know about urban and transport planning, environment and health. If you want to have a PDF copy of the book, give me your card or send me an email, and I'm happy to send it to you. You can also go to the shop and buy it, but then I think it's $160. It's a bit too much. And finally, we're also organizing a conference next year, bringing together urban and transport planners, environment and health people in Sitges, near Barcelona. Beautiful place to come. Even if you're not interested in the topic, just come to visit the place. And there are a few people here that were there last year when we organized it, and they were all happy to come back, I'm sure. Many thanks.